Again, I would like to thank every one of you for joining us on this August afternoon, and now I would like to turn the slides over to Jackie Baralsa. Thanks, everyone.
Thank you, Rebby. Thank you for serving as our greeter today. It's always interesting to have you come and share our information, and the REL, NE, and the Early Childhood Education Research Alliance really appreciate your input. So today, welcome to everyone. We see that everyone who's joining us today, we're confident that you'll gain valuable insights during the next 90 minutes. Thank you for taking time from your busy day, particularly during the summer. We know how difficult that is. I just want to remind you of two things: the chat function in the bottom corner that allows you to make comments and ask questions, and Rebby gave you a preview of how to use that chat function. Claire Irwin, our Alliance researcher, will be monitoring the chat and organizing the questions. We also have a box next to that called Download Today's Files. You can see the PowerPoint presentation listed as today's slides, and so you can download that and share with colleagues as you wish. And we also have a copy of the research study. So you can download both by clicking on the file and then hitting, once the file is highlighted, it will download files comes up. And if you're not familiar with that, you can probably put a question in the chat and we can help you with that information. You may use both functions at any time during this event. Rebby previewed our agenda, and I just want to give you a little more detail. The presentation of the findings will take approximately 20 minutes. Both Deborah Gross and Amie Bettencourt will provide you with information about the followings in their research report and the study that really caused the research report. After that, that will be followed by a question and answer period, a very short one. And then we will allow 15 minutes for each of the states, Connecticut and New Hampshire, to give their perspective on the study's implications, and that will be followed by a final question and answer session. So if you have questions, please don't hesitate to put them in the chat. Let me just share the webinar goals, because not only are we going to disseminate the study's findings and implications, we're going to discuss the challenges and opportunities raised by the study. And we also want to build your knowledge, as well as colleagues' knowledge, about how specific implications are being considered or addressed by different states in our particular region. So let me begin by giving you brief bios for each of the presenters. We just thought it would be easier to give all the bios at the beginning, and then it would be uninterrupted. Amie Bettencourt is the lead author of The Costly Consequences of Not Being Socially and Behaviorally Ready for Kindergarten: Associations with Grade Retention, Receipt of Academic Support Services, and Suspensions/Expulsions. The article that initiated our internal discussion and led to planning this event. Dr. Bettencourt serves as project director of the CHIP project, which is funded by the Fund for Educational Excellence. This research project is examining the impact of the implementation of the Chicago Parent Program, a well-established 12-session parenting intervention for parents of young children in pre-kindergarten classrooms in 16 to 20 Baltimore City public schools. Dr. Bettencourt's position involves collaborating with project schools to ensure smooth execution of the project, overseeing participant recruitment, data collection and management, managing project budgets and personnel, maintaining human services certification and IRB approvals for the project, authoring manuscripts related to the CHIP project, and grant writing to support efforts to extend this project and conduct related research studies. Her recent awards include the 2015 American Educational Research Association Division H Outstanding Publication Award in the area of assessment and accountability, and the 2014 Research and Assessment Leadership Award presented by the Council of the Great City Schools. Welcome, Amie. Deborah Gross is best known for her work in promoting positive parent-child relationships and preventing behavior problems in preschool children from low-income neighborhoods. At Johns Hopkins, she holds joint appointments at the School of Nursing, the Department of Psychiatry and Behavioral Sciences in the School of Medicine, and at the Department of Mental Health in the Bloomberg School of Public Health. Previously, as Associate Dean for Research and a department chair at Rush University College of Nursing, Dr. Gross and colleagues developed the innovative Chicago Parent Program, which improves parenting behavior and reduces child behavior problems. The program is currently used in a number of settings across the country. Dr. Gross was a Robert Ward Johnson Executive Nurse Fellow, and among her many recognitions are the Friends of the National Institute of Nursing Research President's Award for Outstanding Research, and the American Academy of Nursing Edge Runner Award, honoring developers of model programs offering solutions to healthcare challenges. She has served on numerous review panels for the National Institute of Health and the Institute of Medicine, and has published more than 100 articles, book chapters, and abstracts. Welcome, Debbie. Harriet Feldlofer, and she is on the next slide, serves as the Director of Early Care and Education at the Connecticut Office of Early Childhood. The Division of Early Care and Education is charged with ensuring all young children in Connecticut have the opportunity to be cared for and educated in an environment and by staff who provide developmentally appropriate experiences that promote their optimal health and physical, social, emotional, and cognitive development. For almost 3 decades, Ms. Feldlofer worked at the Connecticut State Department of Education in the areas of early childhood education, professional development, family involvement, and school improvement. In her previous position as Chief for the Bureau of Teaching and Learning, she oversaw preschool through grade 12 curriculum, teaching and assessment, and managed over $500 million in federal and state funds. Previous to this position, she served as Chief for the Bureau of Early Childhood Education. She also served as co-director of the state's School Family Community Partnerships Project, designed to promote family and community involvement practices and programs at the local level and to increase public awareness of partnerships. Welcome, Harriet. Mary Eric is the administrator for the Bureau of Integrated Programs and the State Title I Director at the New Hampshire Department of Education. Most recently, Dr. Eric led a reorganization of ECEA compensatory programs to an integrated management model and the development of a problem of practice model of school innovation where the drivers of change are schools and districts. She also serves as a consultant for educational equity at the United States Department of Justice, where she consults about race, class, and culture, inclusive practices, and the roles of state education agencies. Prior to working at the New Hampshire Department of Education, Dr. Eric was an associate professor of early childhood education and a public school teacher in the New Haven, Connecticut public schools. Her teaching has been featured in the documentary Teaching Tolerance in the Early Years, and she is the author of Racially Equitable Teaching. Both hello and welcome to Mary. And I also want you to know that both Ms. Feldlofer and Dr. Eric serve as core planning group members for our Early Childhood Education Research Alliance. So welcome to everyone. And at this time, I would like to turn it over to Deborah Gross and Amie Bettencourt.
Thank you. So there's been an important shift in the most common types of chronic problems affecting children in the U.S. For example, asthma used to be one of the most prevalent chronic conditions of childhood. But as shown in this slide, the top 5 chronic pediatric conditions now are all related to social, emotional, developmental, and behavioral problems. Asthma now ranks 6th. In addition, these social, emotional, behavioral problems are more than twice as likely to occur among children living in poverty. How does poverty harm behavior and learning? Well, poverty increases the likelihood that children will be exposed to high levels of environmental stress. Referred to as adverse childhood experiences, or ACEs, children living in poverty are more likely to be exposed to a range of ACEs such as violence, abuse, neglect, parental substance abuse, parent death or incarceration, discrimination. And many children are exposed to multiple ACEs, not just 1 or 2 stresses. This pileup of traumas and adversities makes it difficult for students to pay attention, manage emotions, and process and remember information. As shown in this slide, children exposed to 2 or more different ACEs are nearly 3 times more likely to be retained in grade and about twice as likely to be diagnosed with ADHD or other behavior problems. In Baltimore City, where over 85% of Baltimore school children live in poverty, nearly a third of children are exposed to 2 or more different ACEs. To underscore the stress of growing up in urban poverty, our colleagues developed a survey of violence exposure at one of the schools located in our study area. 43% of the high school students reported witnessing violence at least weekly. 39% had known someone killed before reaching adulthood. This is a really different childhood than the one we would expect, especially given that Maryland is one of the most affluent states in the country. And as you can imagine, these experiences can have dramatic effects on learning. In 2015, we became concerned about a report showing that 52% of kindergartners in Baltimore City Public Schools were entering kindergarten without the essential social and behavioral skills needed to learn. These are the skills we typically expect children to acquire before they enter school, in the context of a supportive, consistent, and nurturing home environment. So what are these social behavioral skills? They are sometimes referred to as non-cognitive skills. This differentiates them from the cognitive skills we typically think of when we think of children learning to read, manipulate, and compute numbers, and apply new concepts. Yet the non-cognitive skills are quite essential for learning. There are 3 primary skill areas linked to social behavioral readiness for learning: social information processing skills, executive functioning skills, and emotion regulation skills. And I'm going to explain each of these briefly in the following slides. Social information processing describes the unconscious series of steps involved in how we selectively attend to certain types of behaviors and interactions in our environment, assess its meaning and motivations, and how we respond to that behavior. So children as young as 3 years old can differentiate emotions such as sad, happy, anger, hurt, and fear. They also typically have a simple understanding of motivations, and can distinguish between intention and accidental behavior. This enables them to encode and appropriately respond to their own and other people's emotions. So for example, a child who sees a classmate crying may realize the child is feeling sad and may try to comfort that child. However, some children struggle with the social emotional processing and may routinely ascribe hostile intentions to others where none was intended. For example, a child accidentally bumps into another in the hallway, and that child quickly assumes it was an act of aggression, triggering an angry and aggressive response. Children who've been exposed to harsh parenting, domestic violence, and parent mental illness are more likely to show deficits in social information processing and more likely to ascribe negative or hostile intentions to others. Yeah. Executive functioning describes the brain's ability to manage, coordinate, and integrate information. It includes several interrelated functions essential for learning: attending to tasks, shifting attention in response to expectations, inhibiting socially inappropriate responses, and processing, remembering, and using information. These things, executive functioning, have often been called, I should say, as the brain's air traffic control system. In preschool, children use executive functioning skills to listen, process, recall, and use information, follow routines in the classroom and rules, delay gratification, and halt one activity to start another. Emotion regulation skills are important for managing emotions such as frustration, anger, and stress. So as you've probably figured out by now, all of these skills are highly interrelated. For example, children who can appropriately assess the social environment, shift their attention away from unpleasant situations, and refocus their attention to something that is calming or more gratifying will fare much better in a busy classroom than those who struggle with these skills. We know that children who enter kindergarten not school ready have more difficulties catching up. We typically think of these types of readiness skills as those tied to language development, literacy, and knowing your numbers. This body of research has led to significant investments in Head Start, pre-kindergarten education, and other enrichment programs. What we don't know is whether there's a unique contribution of social behavioral readiness on academic outcomes. If social behavioral readiness confers its own separate effect on academic outcomes, and those skills are learned in the context of a parenting relationship, we may need to rethink or expand our strategies for closing the achievement gap. In this study, we examine the impact of not being socially and behaviorally ready for kindergarten on 3 costly academic outcomes: being retained in grade, receiving services and supports through an individualized education plan or a 504 plan, and being suspended or expelled from school at least once by 3rd grade. Our goal is to use this information to inform early intervention efforts for strengthening children's social behavioral skills prior to and during the transition to kindergarten. So I'm now going to turn this over to Amie, who's going to talk about the study methods and results.
Thanks, Debbie. So this study took advantage of access to administrative data from the Baltimore City Public School System. And the data was on 2 different cohorts of students enrolled in city schools. The first entered kindergarten in the fall of 2007, and we followed them through 3rd grade, which was in 10-11 for students who were on time. And the second cohort entered kindergarten in the fall of 2009, and again we followed them up through 3rd grade in 12-13. Just over 50% of the students in each cohort were boys. Over 85% were African American, and between 80 and 90% qualified for the free and reduced price meals program, an indicator of poverty. And between 80 and 83% of students in each cohort had attended some type of formal schooling prior to kindergarten, such as pre-K, Head Start, or other daycare. The measure that we used for this, the primary measure that we used in the study, is the Maryland Model for School Readiness, which is a portfolio-based assessment developed by the University of Michigan. This assessment, teachers rate student skills within the first 60 days of kindergarten on 30 items representing 7 domains of readiness on a 3-point scale from proficient, in process, or needs development. The 7 domains are listed here. They include language and literacy, mathematical thinking, scientific thinking, social studies, physical development, the arts, and personal and social development. The personal and social development domain, which we'll refer to as social behavioral readiness, is the focus of this study and includes 4 items to measure children's ability to show initiative and self-direction, follow classroom rules and routines, use classroom materials purposefully and respectfully, and interact cooperatively with others. Raw scores on each domain are converted into one of 3 categories, which are developing, approaching, and fully ready based on the total points obtained. And prior research supports the reliability and validity of this measure. So in this study, each of the cohorts included over 6,000 students. However, we only included students in the present research who had kindergarten readiness scores on the Maryland Model for School Readiness and remained in Baltimore City Public Schools consistently up to 4th grade so that we could accurately determine grade retention. In our study, all school readiness scores were dichotomized so that all of our analyses, all students either scored as either developing or approaching on a given domain were identified as not ready, and students scoring as fully ready reflected a separate category that we used as our reference group. Because we were primarily interested in the relationship between a child's level of social behavioral readiness and whether the student was retained in grade, received services or supports through an IEP or 504 plan, and was suspended or expelled, we wanted to control for other student characteristics and other types of readiness that influence social behavioral readiness and our outcomes. Therefore, we controlled for as many relevant variables as were available in our administrative data. And these included student gender and race ethnicity, whether the student was chronically absent in kindergarten, whether the student was an English language learner in kindergarten, whether they qualified for the free and reduced price meals program in kindergarten, whether they had attended some form of formal preschool, and the other 6 domains of the MMSR. In addition, because students are nested within schools, we wanted to control for school-level influences, so those are taken into account in all of our analyses. Unfortunately, we didn't have data connecting students to separate teachers, so we could not control for the influences of individual teachers, but we did nest within school to take into account some of that bias. We analyzed the 2 cohorts separately to examine generalizability across testing years. And we also looked at 2 different sets of analyses in terms of the impact of social behavioral readiness in kindergarten and then the impact of social behavioral readiness on outcomes by the time students reached 4th grade. I'm going to go through each of these analyses now. So this first table includes a lot of information. I want to remind you that social behavioral readiness was assessed within the first 60 days of kindergarten, but some of these other characteristics are based on information from the full kindergarten year. There's a lot of data here, so just want to talk about patterns across the 2 cohorts. So as you can see, boys were more likely to not be socially and behaviorally ready than were girls. In addition, students from low-income families were more likely to not be socially and behaviorally ready than students not from low-income families. Students who had not attended some type of formal preschool program, such as pre-K or Head Start, prior to entering kindergarten, were also more likely to not be socially and behaviorally ready. And students who had been chronically absent from school in kindergarten were more likely to not be socially and behaviorally ready than those who had attended regularly. This slide shows that those students who were not ready for, not socially and behaviorally ready for kindergarten, a larger proportion of them were retained in grade at the end of kindergarten and also retained in grade at least once in the next 3 years of school following kindergarten. On this next slide, we control for all those variables that I mentioned before, as well as other types of readiness, and we find that students who were identified as not socially and behaviorally ready were 80% more likely to be retained at the end of kindergarten and 40 to 60% more likely to be retained at some point during the next 3 years of school. This next slide shows just a basic relationship between not being socially and behaviorally ready and receiving services and supports through an IEP or 504 plan. A larger proportion of students who were not socially and behaviorally ready received services and supports through an IEP or 504 plan in kindergarten and during the next 3 years of school. However, when we control for student characteristics and the other 6 domains of readiness, we do not see a relationship between social behavioral readiness and receipt of services and supports in kindergarten, but we do find that those students who were not ready in terms of their social and behavioral skills were 50 to 80% more likely to receive services through an IEP or 504 plan during the next 3 years of school. We then look at the relationships to suspensions and expulsions, and we find that a larger proportion of students who entered school not socially and behaviorally ready to learn were suspended or expelled in kindergarten and during the next 3 years of school compared to students who entered school socially and behaviorally ready. And when we take into account all the student characteristics and the other MMSR domains, we still find that students assessed as not socially and behaviorally ready were up to 7 times more likely to be suspended or expelled at least once in kindergarten, and up to 2.7 times more likely to be suspended or expelled at least once during the next 3 years of school. Finally, I want to highlight the impacts on males. We consistently found across the study that boys were more likely to be retained in kindergarten, to be retained at some point during the next 3 years of school. They were also more likely to receive services and supports through an IEP or 504 plan in kindergarten and during the next 3 years of school. And they were more likely to be suspended or expelled in kindergarten or during the next 3 years of school.
So I want to briefly discuss the implications of these findings. We first tried to look at what the impact of the estimated costs were of these outcomes. And this slide shows some of the costs that we can find. So the cost of grade retention is essentially the cost of 1 year of educating a student according to the U.S. Department of Education, and that cost is about $11,153 per student per repeated school year. The cost of special education or additional services under a 504 plan varies by the need and the type of disability, but it has been estimated that on average, special education services cost districts an additional $10,000 per student per year of services. And although the cost of student suspensions and expulsions are not available, we know that it incurs substantial costs related to school staff time to address the behavioral incidents, lost school funding due to student absence, lost parent wages due to missed work, and to paying others to supervise their children while suspended or expelled. We haven't included the cost of school dropout, juvenile justice involvement, and decreased participation in the workforce, all of which are more likely to occur among children who have experienced these academic difficulties. I want to return to one of our original points that social behavioral skills develop long before children enter school in the context of the family. Although we believe there is wide consensus that parents are central to children's academic and general well-being, we really don't have a clear vision for how to effectively support parents in school settings. For example, there are a number of evidence-based parenting programs shown to strengthen parenting skills and capacities and improve children's social, emotional, and academic outcomes. We do not have a clear policy, strategy, or payment mechanism for building parenting capacities in the school setting. Yet this is where it's having a pretty devastating impact on children. Moreover, schools are natural, non-stigmatizing settings where we want parents to be actively engaged. I also want to highlight that this has impacts on teachers. I know we have a lot of teachers participating, and I'm very curious as to what your responses to these data, probably things that you live with every day. But when teachers are unable to manage student behavior in the classroom, learning for all students is diminished as teachers spend more instructional time on behavior management. And it can also be daunting for teachers when over half of the kindergartners in the classroom are struggling to follow directions, manage emotions, organize and complete tasks, and get along with others in the classroom. While the teacher is accountable for helping their students to achieve a more rigorous standard in reading and math than prior generations of kindergarten teachers, so these data, I think, are particularly hard on teachers who have the high expectations of being able to teach children how to read when they're struggling to get the children to sit still. Not surprisingly, teachers working in urban schools serving high proportions of low-income families can become demoralized. Thank you. So before we conclude, I think it's important to highlight some important study limitations. First, the data were analyzed only for students who were assessed in the MMSR and remained in city schools through 4th grade. As a result, certain groups were more likely to be excluded. Second, there are a number of important factors that we did not measure or control because they weren't available in the administrative data set, such as parent education level, mental health, and neighborhood stressors. And these are likely to have had important, they may have been important factors than just income level. Third, the MMSR social behavioral ratings relied heavily on teacher reports of student behavior. We know from numerous studies that teachers and other adults can hold biased perceptions of behavior that could affect ratings, particularly with regard to African American male students. Finally, we did not control for the type of preschool program that the child attended. Although children who attended any form of preschool fared better than those who did not, we cannot discern from the study whether one type of preschool program had stronger effects on social behavioral readiness than another. Thank you. The study results are consistent with a number of other studies, particularly that significant vulnerability of boys growing up in poverty and the finding that poverty's effect on learning starts early. The study does extend prior research by showing the unique contribution of social behavioral readiness to three costly academic outcomes: the likelihood of being retained in grade, the likelihood of receiving additional services and supports, and the likelihood of being suspended or expelled from school. Finally, we highlight here the four main categories of evidence-based programs that have been shown to have positive effects on children's social behavioral skill development: parenting programs, teacher support programs, mental health consultation, and social skills training for children. And these are all costly. There's no question. But I think if there's anything that we learned from doing this study is that the cost of not addressing the growing problem of children entering kindergarten without a strong social and behavioral foundation could be greater. Thank you.
Great. Thank you very much, Amy and Debbie. That was really an amazing study, and we're very excited that we had the opportunity to have you present that today. My name is Claire Irwin. Jackie had introduced me earlier. I am the lead researcher for the Early Childhood Education Research Alliance at REL Northeastern Islands. And I'm going to lead just a quick Q&A session. I've been trying to get folks to ask questions in the chat. A few more are coming in now. And we did have some questions that were asked during the registration process. So I think one of the ones that I'm not 100% sure, Debbie and Amy, I know you talked about implications for IEP, children with IEPs. Someone was wondering what the percent of the sample received special education services during that pre-K to K transition.
Unfortunately, we don't have that information because we were focusing primarily on kindergarten as our starting point, so we don't have access to the rates of special education and 504 plan services in pre-K.
Yeah.
But I would imagine it's going to track similar, although slightly less than the rates that we showed you for because it's a smaller sample of students, so it's about 4,000 students compared to a little over 6,000.
Great, thank you. Yeah, it's always hard to track between the pre-K K. I know that's always difficult. And there was a question about whether or not the results for males were different across SES or ethnicity. So was there an interaction there or not?
So we did explore looking at the interaction between gender and race ethnicity and did not find a significant interaction effect, so we didn't pursue that further, though we would like to look at in further research to kind of unpack that a bit more and also to unpack findings related to SES, which we didn't have the chance to explore in this study in terms of its interaction with gender.
I think that we found that the English language learner children tended to be less likely to that might have been important. We did not look at that more closely.
Right, right. And was there an interaction between English language learner status and sex, or was that was a separate finding?
No, there was no. I'm not aware of any. I don't think we had any interaction effects with gender and English language learners.
Okay, great. Thank you. And I'm just sifting through the questions now, so bear with me. They're coming in fast now. So this is an interesting question related to gender, kind of going off of that. If there was any information on if teachers were male versus female in the study, and if that may have had an impact on your findings.
That's a really great question, and it's one of the things that, one of the limitations of the data that we have. We unfortunately have no way of connecting individual teachers to individual student scores. And so we also can't account for any of the characteristics of the teacher, such as gender or race or things like that that would have been important to take into account. We're hopeful, the system has a new assessment now, and we're hopeful that if we have the opportunity to replicate these findings, that we'll get to address some of these limitations.
Mm-hmm. Yes, it would be interesting to take a look at that. Okay, so we have 5 minutes left for some questions. Again, I'm trying to sift through these questions. They're coming in like wildfire here. Let's see. Oh, there have been actually, this question has come up several times related to age in the registration questions. And then also here I see someone's asked about what is the age that children start in kindergarten in Baltimore. Of course, we have a national audience today, and there are some states that have quite a late cutoff, such as Connecticut has a January 1st cutoff, and then there are other states that have an earlier cutoff. Did you take a look at that, or even if you didn't, would you think that that might have an impact on children's social behavioral readiness, I guess, related to your findings?
I think that's a really good question. We did not take into account age, though for the most part, in Baltimore City, students have to be 5, and I'm going to be, don't quote me on the actual cutoff for that, but I believe it's either September 1st or September 15th, in which they have to be 5 in order to start kindergarten. Although there are some exceptions, I believe, for students who qualify for free and reduced price meals. It would have been a good idea, I think, to control for, at least look at the impact of age versus grade to see if we're kind of pick up different or control for different factors in there.
Right, and there's no question that all of these skills develop, continue developing quite a bit over early childhood, and then some children enter in late. I think the important information and relates to what we were able to, the data that we had available, is that this is what kindergarten teachers are facing when they're trying to, and the expectations for what should be taught in kindergarten have gotten so much more stringent. And so I think that we're always going to have children entering in kindergarten at varying levels of development. But they're 5, and so this is what the expectation is that they enter kindergarten.
Mm-hmm. Yeah, it's definitely, I think, a contentious issue in some states, thinking about what's that cutoff and are they really ready. One question that came in, I want to prioritize what came in on the chat, but one good question I think that came in on the registration was, what should districts do with this information? And I think you've touched on this a little bit, but and please tell me if you're not prepared to answer that question, but do you have any advice on what districts or states might do with the information from your study?
I think that right now we don't have great answers. I think we've got more data showing we have to really relook at how do we engage parents and families in schools, and that I think that there's been a terrific response from both policymakers, the business community, and researchers, economists, everybody realizing how important these first 5 years are. And much of it has been funneled into enrichment programs that have really focused on language and literacy and learning how to manipulate numbers and that level, those cognitive skills of readiness. I don't think we paid nearly as much attention to how important these social, emotional, and behavioral skills are to everything. And we can't lay that on teachers. I mean, these are the things that we have traditionally expected children enter school having. And so I think that, if anything, it means that we need to rethink how are we really trying to address the achievement gap, and who should be the partners in that. It can't all lay on the backs of educators. It's really got to, I think, engage city leaders and healthcare partners, and many other, and the business community especially, because these are the things that are really going to affect long-term ability to enter the workforce.
Great, wonderful. Yes, it should be a collaborative effort, I think. That's wonderful. So it looks like we are just up with time. We are right on time today, which is very exciting. So I am going to stop with the Q&A session now, but we'll have another one after we hear from our two state perspectives. So with that, I'm actually going to pass this off to Harriet Feldhofer, who is going to talk about the perspective from Connecticut. Thank you, Harriet.
Good afternoon. Thanks for inviting Connecticut. I'm pleased to share the work we are doing in Connecticut to support social and emotional functioning. I'm going to talk a little bit about our early learning standards, about the types of guidance we're providing to higher education faculty and caregivers and families, and also preliminary results from year one of our federal preschool development grant. So in 2011, Connecticut was developing a new set of birth to 5 early learning and development standards, which were then launched in 2013. And we recognize the importance of self-regulation and executive function and the impact that both of these have on social and emotional functioning. Our birth to 5 learning standards are comprised of 8 domains of development. And the domains and strands within the standards reflect common areas of research and evidence-based practice. Well, we know that children don't learn skills in these domains, strands, or learning progressions in isolation. And it's helpful to think about growth across these areas to make sure that support is being provided for the wide variety of skills children are learning. Now, this slide just shows both the social, emotional learning and the cognition domains with their related strands. And again, in Connecticut, these 2 domains underscore the importance of self-regulation and executive function and the impact both have on social and emotional functioning. I'm looking for there we go. We developed a set of 5 guidance documents in Connecticut to accompany our standards. These documents include evidence strategies to support learning and development for each strand within the standards. This is a screenshot of 2 of the guidance documents. The top left is the Guide to Domains and Strands, and that contains information about each of the 8 domains and general ideas about promoting development in each area. It also includes guidance of the strands and why these are an important part of children's growth and development. It also includes age range descriptions, a section that includes ways to support growth and development in this area for children with disabilities and children who are dual language learners, and finally, strategies to support growth and development across the learning progression for each strand. The strategies are broken down into 2 sections, which I'll show on the next slide. One section focuses on environment, materials, and scheduling, and the other focuses on teaching behaviors. The bottom right cover shows the Guide for Building Meaningful Curriculum, and this explores the components of a rich, challenging, and achievable curriculum. Examples of intentional teaching, planning meaningful learning experiences, the importance of play, ongoing assessment, and family engagement are addressed in this guide. As I said, these guidance documents articulate evidence-based strategies, connected research to practice and are directly aligned to our learning standards to support the development of social and emotional learning, including self-regulation. So this slide shows the strategies for providing appropriate materials, scheduling, routines, and planning the environment to support development along learning progressions in this strand. And this slide shows the teaching behaviors, including the ways that adults interact with and respond to young children that support social and emotional development, and in this case, the development of self-regulation. Play is the most important defining behavior of a young child, and research shows us that it cannot be replaced by any other activity. Play contributes to and enhances all areas of development in young children, and it is the principal activity through which social interaction is facilitated in the early childhood classroom. Our guidance documents all focus on the pedagogy for supporting social and emotional development through play. Our guidance emphasizes a pedagogy-integrated curriculum that draws on children's interests. These types of curricular approaches have the advantage of offering the opportunity for deep involvement in topics that children are truly interested in. It promotes exploration, inquiry, and self-directed learning. So our guidance document includes an inquiry process which can be used to develop units of study based on a variety of topics and content areas. The process involves the 4 steps which you see on the slide, which may be repeated to more deeply explore topics. One of the recent exciting collaborations around our learning standards has been with Eastern Connecticut State University Center for Early Childhood Education. We partnered with them to develop a video library and 40 companion guidance documents for use with higher ed institutions, program directors and their staff, and coaches and TA providers. The videos feature providers from a variety of early care and education settings across our state. One series in the library is focused on mental health and includes topics such as understanding challenging behavior in young children. The videos focus on fostering essential dispositions in young children, supporting dramatic play centers, supporting children's social and emotional development, understanding challenging behaviors in young children, and also, importantly, reflecting on our own reactions as adults and responses to children's behavior. So this slide just shows the covers of the supporting guidance documents that you can use in college courses, in early childhood program, and again in trainings. We're getting really lots of positive feedback on this initiative, and as of June we had more than 20,000 viewers look at these videos. We're working closely with our State Department of Education on drafting and vetting K-3 social, emotional, intellectual habits framework. And again, the feedback's been very positive from K-3 teachers. It's something that they've just really been waiting for a long time and love having the permission to really address this in their classroom. So the State Department of Education is really working with the State Board of Education to approve this, and then, of course, write guidance documents that can articulate strategies for embedding these in K-3 instructional classroom practices. And finally, the sort of research the findings we're seeing from some of these practices. Connecticut received $12.5 million in the first year of a 4-year federal preschool development grant. A major goal of our grant is to ensure that children served have access to high-quality early learning programs and positive social and emotional learning environments and prevention support. A key strategy identified in our preschool development grant is the provision of early childhood mental health consultation, and that's provided through the Early Childhood Consultation Partnership. We call it ECCP in Connecticut, and that's for each classroom receiving funding in our preschool development grant. We have 53 classrooms in 13 communities that are serving 712 children right now. So ECCP works with the preschool programs to build the capacity of caregivers at both the individual, family, classroom, or program level. And they have three major goals, and it's to reduce the risk factors associated with early childhood suspension and expulsion, to build the capacity of early child care providers and families to understand and promote healthy social emotional development, and to effectively address the needs of children ages birth to 5, and then also to engage and develop community and regional and statewide partnerships in an ongoing basis to support capacity building in the area of healthy social emotional development for young children. Every PGG classroom receives ECCP's core classroom support and child-specific services. The core classroom service is a 3-month program that provides weekly social-emotional consultation services. The child-specific service provides focused consultation to a child when concerns arise about the child's social skills, emotional development, or challenging behaviors, and they've been identified. So during the course of the ECCP core classroom service, the consultant may provide up to 2 child-specific services. And these services are intended for children where the teacher or a parent have concerns about the child's social skills, emotional development, or challenging behaviors related to family stress, or a possible concern of a mental health-related issue. And then for both of these services, there's a 1-month follow-up with all parties, and that includes the administrators, the teachers, and family members. I'm giving you some findings from a mid-year, year 1 results, which was from January 2016. And they're looking good. We'll have more results at the, we're analyzing right now for the entire year 1. But this 499 children were served in core classroom services, and 35 received child-specific services. In addition, 111 children had child-specific meetings which involved families, and also 30 home visits have been conducted serving 59 family members. Our initial results show that nearly 67% of the preschool development grant teachers showed meaningful improvement based on class scores in 2 or more dimensions. And then 100% of the children within those classrooms had improved ratings from pre-tests using the child-teacher report form, a teacher rating scale that measures the effectiveness of services provided to individual children. And in addition, 80% of the children showed improvement on ratings from pre-tests based on the child behavior checklist, a parent rating scale that measures the effectiveness of services provided to individual children. The remainder of the children that are being served will be assessed through the spring, and as I said, this summer we'll have further results on those. And here's my contact information, and certainly feel free to follow up with me if you want additional information or just would like to chat about this work. Thank you.
Great, thank you, Harriet. And we can move on now. We're going to hear from Mary Eric from New Hampshire Department of Education.
Hello, and thank you for inviting me to present on your panel. I'm a huge fan of Connecticut, I have to tell you. I was a teacher in New Haven for 18 years, and I use all your materials in early childhood. First, I'd like to start by giving you a little bit of context about New Hampshire. New Hampshire only requires half-day kindergarten. Pre-K is not funded, and 100% of our work here at the New Hampshire Department of Education and the Bureau of Integrated Programs is federally funded. I have no state funds. I think this is an important context as I share with you our journey and what we've done around a voluntary pre-K model that's grounded in an understanding of the need for socio-emotional support, specifically self-regulation, executive functioning, and early screening. We also are a New American Relocation Center with the highest percentage being forced relocated immigrants. And we have one of the highest incidents of opioid abuse in the country. Since 2008, we've doubled the percentage of families living with the challenges of poverty, and which has gone along with a huge increase in suspension and expulsion in early childhood. Our urban school centers have an excess of 85 languages and dialects within one school or district. And our homeless population is increasing at similar rates. In 2015, our first homeless pre-K program opened up in Nashua, New Hampshire. Over the last 2 years, we have been able to increase the number of young children and families benefiting from pre-K from 6.5% to 25% using Title I funds. In addition to that, another third of our children are supported using Head Start at 5% and special education at 8%. We've done this through focusing on a graded funding model of our federal funds, because as I said, we are state funds. I mean, we have no state funds. In building coalitions across our state, outreach and partnerships, in workforce development, and building leaders. A key component of this was working with our Early Learning New Hampshire team, led by Jackie Cowell. Since 2013, the New Hampshire Department of Ed and the Early Learning New Hampshire have collaborated on an early childhood summit with the expressed goal of engaging our business and legislative stakeholders, and co-sponsored by businesses such as our charitable trust, Spark New Hampshire, our local dental organizations, and our Endowment for the Health. Engaging our business and philanthropic communities has been central to the success of building strong relationships in our communities. The New Hampshire Department of Education also works closely with Spark New Hampshire. This is our Early Childhood Advisory Council. It was created to promote a comprehensive system of early childhood programs and services in New Hampshire. Spark New Hampshire's 23 governor-appointed professionals have experience in early learning and development, health, and family support, which has assisted us in thinking more around full-service community schools. Spark New Hampshire specifically created a public awareness toolkit to help build awareness of the importance of early childhood. And as I mentioned earlier, we've been able to increase pre-K programming and full-day kindergarten in New Hampshire by 300% in the last 2 years. This was due to relationships such as the ones forged with Spark New Hampshire. They actually support cadres and ambassadors by offering them free online training materials that include PowerPoints, as well as research associated with self-regulation and socio-emotional support. We've been building capacity through a state education agency leadership building initiatives. We do this through the New Hampshire Problems of Practice model of school innovation and partnering with national groups focused on early childhood leadership. Our New Hampshire Educators Problem of Practice model of school support is a year-long professional development project that begins with an intensive 3-day summer summit that we just ended Friday, where we bring national and local experts and we convene with school innovation teams. Central to this process is that these school teams coming to the summit, 50% of their team can be community partners. And although the New Hampshire Department of Ed's primary charge is kindergarten through 20, the outpouring of support for early childhood has been seen in the community partners our schools have chosen to bring to the New Hampshire Educators Summer Summit. 20% of all participants attending this year had relationships or were associated with the early childhood community. The outpouring and outreach efforts have also been seen in the problems of practice that we have. We require schools to submit to us in order to attend the summit, and over 25% of them intersect with early childhood, specifically pre-K and K, and family engagement. Our school teams include family members and community partners, And this model is expanding buy-in and agency of local communities to understand research, specifically around supports for self-regulation. In fact, the problems of practice this year were so rich in their focus on early childhood that Dr. Elena Bedrova from Tools to the Mind was our closing keynote for educators that spanned pre-K through high school. Early feedback from the summit, some of the educators that were most impressed with our closing speaker were our high school and middle school teachers, saying that they could benefit from understanding more issues around socio-emotional engagement, school connectedness, and self-regulation. In addition, we have close partnerships with CELO, the Center for Enhanced Learning Outcomes, the National SWIFT Center, West Ed, Industar, and the Northwest Comprehensive Center. We have been able to look at indicators in our Industar system with the support of CELO, look at indicators around inclusive education with our national SWIFT team, and look at what are the implications for adding pre-K and full-day kindergarten through our efforts and collaborations with West Ed. The way we've been able to fund this is through an ECEA-braided funding model. We build all our initiatives on leveraging funding across all title programs. Bureau of Integrated Program oversees all federal funds that go to schools except for special education funds. We braid Title I, Title II, Title III, Title IV, homeless and migrant education funds in order to support comprehensive preschool programming in 5 regions in our state. We build quality through workforce development. We've developed the New Hampshire Early Learning Standard. They're a project from the Department of Health and Human Services, Division of Children, Youth, and Families. They first were developed in 2005 and edited most recently in 2015 by a cross-sector steering committee that spanned higher ed, child care, the business community, public schools, and community health service agencies. In addition, they were vetted at various stages by Dr. Sharon Lynn Kagan and Dr. Catherine Scott Little, also Dr. Jeannie Reed. These reviews were funded by our National Governors Association, SPARC New Hampshire. This is one of the many ways that we have to braid our funding to best support all children in our state. The revised draft was provided electronically for review and state feedback throughout New Hampshire. New Hampshire develops state-level task force, and we leverage technology to ensure that a wide stakeholder group has feedback on all our readiness standards. They have since then been adopted and are used within our programs in higher ed, as well as in-service and pre-service teaching programs. In addition, we have New Hampshire kindergarten readiness indicators, very similar to Connecticut, but not built out like Connecticut's, that are aligned to our standards. The last piece for workforce development we did with the Comprehensive Center, specifically Sarah Hughes, who I'm a huge fan of, who worked in developing a state-level task force with the New Hampshire Department of Education and in collaboration with our Commissioner of Education to support schools, school districts that wish to develop comprehensive services for preschool programming across bureaus. Therefore, many of the programs that New Hampshire is currently supporting for pre-K and full-day kindergarten are in collaboration with Health and Human Services, specifically Head Start, a local child care screening agencies, and the Bureau of Special Education here at the New Hampshire Department of Education. New Hampshire has focused on agency and empowering local officials to take charge of the need to educate our preschool population. We are a local control state, meaning that pre-K in schools must be voted in by local school board agencies. the work of Spark New Hampshire in developing ambassadors through their outreach program, the work of the Spark New Hampshire Governors Association, and the work of our national partners has given power to our local initiatives to raise funds through the school boards and develop projects such as Impact Monadnock. This is an organization that has the highest rate of families living in poverty rising to critical levels. They're dealing with the opioid issues. They're dealing with a high rate of students that are not graduating high school, and they use the tools developed by the New Hampshire Department of Ed, Spark New Hampshire, as well as those provided by our national outreach to develop documentaries that we're hoping will really resonate with residents in the communities, and not just educators, but with politicians, with law enforcement, and with families. So I have a short film clip that I would like to share with you to show you how we can empower our local LEAs, our local community members, to take charge and put pressure on legislators to fund preschool education programming. So with that, I'm going to turn it over to my partner who's going to start the film.
Take a good look. Our future is staring us right in the face. Because what happens to these children and all young children in our community will impact every aspect of life in the Monadnock region for decades to come. Start small, think big is the Early Childhood Development Initiative of Impact Monadnock. And it's based on powerful research showing that the health and prosperity of any community is strongly tied to the welfare of its youngest residents. Our community's future literally begins right here. And that is why Impact Monadnock is focusing all its energy and resources on helping these children and their families succeed.
To create a thriving community for the 21st century, we have to invest in our very youngest and most vulnerable citizens. And in our case, that's investing in children aged 0 to 5 and their families.
Children are born and their brains are just ready to learn. Their experiences are what shape how they develop. We're kind of building the basement here so that their life can be built on something that's really solid and takes them into the future in a positive and healthy way. I think families have lots of stressors. You know, sometimes we don't realize that that exists, but there are also families that are really struggling.
Now that I'm closing out my career, getting there, 30 years into it, having arrested third generations within a family, boy, if that doesn't open your eyes. So if 30 years ago, that person that I now arrest today had been dealt with differently as a child, I would bet anything that I would not be arresting him today. He wouldn't be a part of the system.
I think the biggest problem in the state, I used to say it was the economy, but I think that it's the opioid problem right now. I fear that we could lose money.
Thank you. Monadnock is one of 5 regions in New Hampshire taking on early childhood pre-K programs and the need for it. Their work, in collaboration with some of our national work, has actually made it to the New Hampshire legislature. Impact Monadnock material to hopefully impact legislators' thoughts, ideas, and opinions on the role of pre-K in supporting lifelong learners. Thank you very much.
Great, thank you. Thank you very much, Mary. That was really interesting. It's so great to hear what's going on in two of our states in this region. Both, as Jackie had mentioned early on, both Mary and Harriet are core planning group members of the Early Childhood Education Research Alliance, so we're delighted to have them with us today. So what we'd like to do now, I've been trying to get questions in the chat. I'm sure they'll come flying in again as we start this discussion here. We have about 10 minutes or so set aside to have another 10, 15 minutes or so for another question and answer session. And we'll do this with all of our presenters, but I think we'll start with the states. And so we did have a couple of questions come in for Harriet as she was presenting about Connecticut and how they're working with the early learning standards specific to social emotional learning. One question, Harriet, was, does the child-specific service occur outside the special education referral or 504 planning process?
Yes, it does. This is part of the ECCP, which is not related to the 504 or Part B service. This is really a consultation project that is separate.
Okay, great. And there was another question that was asking about the qualifications of the therapists in ECCP, what they are.
I couldn't speak specifically to that. I would be glad to get people information on the ECCP and who their therapists are. But they are all trained therapists, and they're based in New Haven, Connecticut, but they do work statewide. And I would be glad to get you a link to ECCP so you could get on and see actually all of their services. The ones that I described were really developed for the PDG grant program.
Great, thank you, Harriet. That would be useful. And one other question that came in, Harriet, was related to outreach to parents. And so the question came up was whether or not Connecticut has developed programs to reach out to parents before they're in preschool programs, recognizing that the grid shows that there are learning expectations below the pre-K years, but most children don't come into formal pre-K programs until they're about 3 to 5.
Mm-hmm. We actually, when we developed our standards, we developed a family action guide, which was a parent-friendly, like 12-page handheld document, brightly colored, and it really outlined what families could do to promote different areas of development in English and Spanish. And a lot of our providers actually use that with families. And it was actually one of the documents that got the most requests. We actually had to publish 100,000 more. We also have a very robust CCR&R that families can contact. And it's a user-friendly website and talk about quality and also supporting children's development. And then one component of the PDG project that I did not share evaluation findings on is a specific family engagement component. So there are a variety of ways that we are, reaching families. Our website also utilizes social media, and so we know that a lot of families, particularly young parents, have internet access, mobile phones, and so we ran a campaign called "The More You Know, the Better They Grow," and still running, and where we tweet messages and videos and information about child development to teen parents, and we actually target women who are of childbearing age to get information. So we do it through a variety of ways, and we way before children are age 3 or 4.
Mm-hmm. Yeah, it sounds like you're getting very creative too with how you're reaching parents, and that's really interesting.
Yeah,
and,
we don't expect them to come to meetings anymore. That's old school, right? So yeah.
Right. Well, who has time? And we all want to have time. Great. Well, thank you, Harriet. I don't think I've seen any new questions come in specific for Connecticut, but there were a couple of questions that came in specific to you, Mary. One question was whether or not there's any evidence to push the state to mandate full-day kindergarten in the near future.
Well, as I said to you, that we've increased pre-K by 300% in 2 years. So what we're doing through our problems of practice is that local school districts are collecting impact data for us. So although I do not have the funds to actually go in and do the research, it's coming to the state, and we anticipate in the next 12 months to have some compelling data to present to that legislative subcommittee that I mentioned. That's looking at preschool suspension and expulsion.
Great, great. And in terms of, is that for, it sounds like you're doing that for both pre-K, and is it also for kindergarten, so the value added of having a full day of kindergarten?
Correct. So we have, through our problems of practice model, our local schools that have the greatest gaps must submit data to us on an annual basis. And we have this whole subset now that are collecting data around pre-K and K impact. It's been overwhelming. It's just that we haven't been able to organize it due to a lack of funding. So we're thinking this is the year, because now we have a large enough N with the increase to really get some impact data documented.
It sounds like you have some really great partners who can help you push this forward in your state, and that's hugely important. Yeah. And another question came in related to whether or not impact was connected to the collective impact approach of community organizing.
Yes. Well, we have 3 different communities that have done work such as I shared with you, bringing the whole community stakeholder group together, coming up with a strategic plan, and then implementing that strategic plan, most of them starting at birth. So I didn't go into all of that for this presentation, but like Monadnock, it begins prenatal, and it's going all the way up to the transition into kindergarten. And so what we're hoping to do in the future is be able to capture that. Right now it's being captured by local organizations and groups in a more qualitative manner. We're hoping in the next 3 years to move that to elevate that, so that we can we can look at the community impact variable that we all know plays in full service community schools.
Great. And something that I want to put out to both Harriet and Mary, it's a question that I asked. I came in registration, and I asked it of Amie and Debbie. But what do you think that your states should or could, states and districts should or could do with the information from the study that that Amie and Debbie presented earlier? Maybe I'll put that out to Harriet first to answer that.
So you're asking what LEAs, what districts can do or should do?
What districts can do, or what the state might be able to do based on that study and studies like it.
Yeah. So we have actually some legislation around suspension and expulsion, prohibiting suspension and expulsion in K-3 classrooms in Connecticut, which is a great start. And what we did in our agency was actually write a position statement around suspension and expulsion in pre-K classrooms to really mirror the, even though the K-3 legislation did not include preschool. So that's one of the things that we're trying to do, is get out information about the negative effects of suspension and expulsion. And in our programs that we fund at the state level, we do not allow providers who receive state funds to suspend or expel students from their programs. And that's, makes a huge difference, we think. We'll just say this is a practice that we won't provide state funding or federal funding if that's the case. And so again, and I think things like supporting projects like ECCP for preschool programs is very important. I mean, it's a resource that the state can bring to classrooms and programs. And it's not just about an individual teacher, but it builds capacity in the entire program and in the community. So I think it's those kinds of more robust practices that states can really take on and not remain silent.
And hi, it's Mary. So as I mentioned earlier in New Hampshire, that we did testimony at the legislature around the statistics that were emerging nationally last summer, and this has led to a task force that I hope will in suit do what Connecticut did. But that said, we took that data and we have a year-long professional development model in our state, and so we had a series that was supported by CELO on alternatives to suspension and expulsion in pre-K. So we've already engaged all the stakeholder groups as far as public educators, and we invited our collaborators in the Burke Defied community to attend those sessions. So we want to take this work and we want to put it on the ground. And so our Early Childhood Leadership strand of the New Hampshire Educators Summit also has plans to develop some tools that we will then post at the New Hampshire Department of Education to support teachers in this effort. But you know, on a larger level, what the conversation that this has really spurred in New Hampshire is more around inclusive pathways in education. And so we actually wrote a small pilot grant with 5 schools. And what we're looking at is what's the impact of non-graded systems? So moving back towards multi-age settings, and could a non-graded competency-based system assist in supporting socio-emotional work habits and skills, both of the students, and we also feel that the educators can benefit from that. So it's on 2 levels. We're on the ground that we need the legislature to get together and help us push through some legislation, but then we're thinking on a bigger state level about what are new opportunities to rethink child development so that situations like this don't occur.
Right. Great. Yeah, I think this is another, this just shows how research and practice and policy really are all interwoven and makes all of the work that we do here at the REL and in other places so important. One question came into the chat, Mary, as you were talking from Beth Barrett, asking about data collection. And is the data collection online, or can you share the questions you're gathering data on? And I'm not sure if, Mary, if you understand that question, or if we should.
No, I do. I do understand it. So the clarification I have to give is that we don't mandate any certain data collection. All schools are collecting literacy data, and so we have access to that data, and we can look at that in relationship to matched samples. So schools that have full-day kindergarten versus do not have full-day kindergarten. But what we're looking at right now is this really aggregated data source, and what we want to move towards is to disaggregate that data and look at it from subgroups, right? And that's where New Hampshire is at a disadvantage to other states. Since we don't have state funding to support that, and because we don't have state funding, we have a very difficult time applying for federal grants. I've applied for every preschool development grant, but until there's some buy-in locally, I don't think we can move to that level. The questions we ask in our problems of practice I can share, but that's around school culture and climate and gap data. And then we have a subset of schools that choose to share the data on their pre-K and K literacy.
Hello, this is Jackie. Claire, are you still there?
I am on mute. Thank you, Jackie.
Oh.
Wow.
You panicked me, sorry.
Jackie knows that I'm a talker, so of course. Thank you so much. I didn't want anyone to hear my typing. I was just saying, I think we have time for one more question. And I'm actually going to go back to a question that came from registration. I think that these presentations have been fabulous, and this Q&A has been really useful. I wish we had more time. But one question that came in is really a broad question. Is there something you would like to see as an emphasis in working with children in early childhood to support kindergarten readiness? So I think since we haven't heard from Amie or Debbie in a while, perhaps we will shoot that question at you first.
So, I mean, how can we better support in early childhood? Is it more of a general question?
It's really more of a general question. What would you like, I guess, if you could have something be the biggest emphasis in early childhood to prepare children for kindergarten, what do you think that should be?
Well, I think based upon the research we presented, I think that, there's a lot of effort, wonderful effort as was presented about building more supports for teachers and in the classroom, and I think that's terrific. I think the part that we need to figure out is how do we fund in a sustainable way and support capacity building for parents starting in pre-K and helping them support their children in this transition behaviorally and emotionally.
Great. We are getting up on time, but Harriet or Mary, did you want to weigh in on that question?
Hi, it's Mary. So I'd like to respond first that federal funds can be used to support families at every level, from prenatal to 20. And the braided funded model, that's how the braided funded model that we're putting forward in New Hampshire, we're using it to do a lot of work around that. In fact, a third of the problems of practice in our state and a third of our attendees, the 700 attendees at our conference, were focused on family engagement and support. If I could have my one dream, that's what I'm going to share with you. I would have play-based education with a focus on self-regulation in pre-K and K that transitions into professional development for my first to third grade teachers so that they can even continue engaging in that pedagogy as they move the students towards a project-based learning environment.
I think that's a great goal, Mary, and very well stated. And I think we just have to have the leadership, knowledge, and practices, really aligned to that. I think teachers are looking for that opportunity and want to be able to include those practices in their curriculum in their classrooms, right, and often feel a lot of pressure.
So I would say for every teacher on this call, every administrator on this call, contact your state education agency, contact your Title I director, that's what I am, and start sharing with them that these are the practices you want to see. That's what happened in New Hampshire. They contacted the commissioner. And so that's why you're seeing the changes in how we view pre-K with additional funding locally.
Great. And I absolutely hate to cut this short. It's always tough to time these events. We don't want them to be too long, but we also want enough time for discussion. So I'm going to pass it back over to Rebbe. Thank you very much for your great questions, for your great answers and discussion. So Rebbe, I'm passing it back to you.
Thank you, Claire, and thank you all so much for giving us your time this afternoon. Thank you to our fabulous panel of presenters. This was all just so much great stuff to think about. I want to remind everyone to keep your eyes peeled for the archive of this event that will come in a thank you note and to share with any colleagues that were not able to attend today. And please remember to complete the survey that